Once we have diagnosed the patient having a tuberculosis, then the treatment not only is towards the local but also towards the systemic disease. And non-surgical treatment of the tuberculosis involves the anti-tuberculous drugs. There are different drug regimens which have been prescribed in the different countries, and every country, especially the countries we have endemic population of tuberculosis, they have different problems over here. But usually the first four drugs which are mainly done is actually isoniazid, rifampicin, ethambutol, and pyrazinamide. These then again, depending upon its pulmonary TB or its post-pulmonary TB or its osteoarticular TB, different drugs are given for the different period of time. Initially, these four drugs are started, which can be given for 2 to 4 months, depending whether it's pulmonary or extrapulmonary TB. Then isoniazid and rifampicin can be continued for our next 8 to 12 months as well. So the total duration of the treatment is usually for the bony tuberculosis are involved the tuberculosis which is osteoarticular is usually 12 to 18 months. At times you have to cater for resistance as well, especially in the countries who have endemic population of tuberculosis. There is a lot of resistance to isoniazid and rifampicin as well, and therefore we have to keep that in mind. Then there is second generation of drugs which involve multiple other drugs like methotrexate, streptomycin, and then you have levofloxacin and multiple other drugs which may be as a second line drugs for tuberculosis. But usually the first line drugs are only 4 of them, that is the isoniazid, rifampicin, ethambutol, and pyrazinamide, and they all have to be used for non-surgical management. Then, as you know, there may be associated like soreness, pain, swelling, and limp may also be there as well, because there is inflammatory process going on over there. Therefore, it will be difficult for the patient to initially straight away, despite once the medication started, straight away patient may not be able to walk. Therefore, we can give them some form of splint or knee emulator, in which knee can be immobilized in position so that the patient can easily bear weight on the other knee. And once over 3 weeks, 4 weeks, or 5 weeks, once the patient settles down with the antimicrobial therapy and the swelling and all this starts to go down, then you can start giving them exercise therapy, and rehabilitation can be started, and gradual weight bearing and gradual return to normal function can be started. Therefore, the mainstay of the non-surgical treatment of the tuberculous arthritis is actually the antimicrobial therapy. That is the start of anti-tuberculous drugs, which include isoniazid, rifampicin, ethambutol, and pyrazinamide. All other adjuncts are actually depending upon the patient's situation. We can give them splints, knee immobilizer, bed splints, or even rehab therapy can also be started depending upon how the serious the arthritis is and how much difficulty the patient is feeling to continue his activities of daily living.